Hello and welcome to Healthy Bites. Today I'm going to talk about CoQ-10. CoQ-10 is a fat-soluble coenzyme. The molecule is part of many things that we eat in our daily diet, and it also occurs in every single one of our cell membranes. CoQ-10 has several roles in the body. It is an anti-inflammatory and antioxidant. We know that it has an effect on the mitochondria, and with that helps the body boost up energy production, which is quite important. It also increases the production of other antioxidants in the body, which again is going to be good to counteract some of the inflammatory diseases we see, because free radicals will damage natural tissues, and the antioxidant effect of CoQ-10 and also the fact that it encourages the body to produce other antioxidants gives it a very strong antioxidant and anti-inflammatory effect. We also know that it has a protective role in the vasculature, in vessels, blood vessels. So we know it can help improve blood flow to tissues. And we know that it also can prevent oxidative stress that we see in high blood pressure and heart-related issues. In general, CoQ-10 is a good supplement to take to support heart and brain health because of the strong anti-inflammatory and antioxidant actions. There's a lot of diseases and problems that we see nowadays that have been linked to low CoQ-10 levels. There's fibromyalgia, we have diabetes, cancer, heart failure, neurodegenerative diseases, mitochondrial and vascular diseases, muscular diseases, as well as in general heart and brain function depend on appropriate CoQ-10 levels. For example, if you are on statins are believed to reduce CoQ-10 levels. So the latest recommendations for people who are on statins is to take CoQ-10 as well as a supplement, because that can counteract the depletion of CoQ-10 in the body. And also studies have shown that it can negate one of the major side effects that we see with statins, which is overall muscle pain. So if you're on a statin and you're not taking CoQ-10 yet, I would recommend to go back to your prescribing doctor and talk to them and see if they would recommend for you to take a CoQ-10 supplement, and they can work on the dosage with you as well. Same thing if you have fibromyalgia, if you have diabetes. CoQ-10 in general is a very safe supplement. You want to make sure that you stay within the recommended dosages, and I always recommend to start with the lowest dose first. You do not want to start with a super high dose. More is not better. So start with the lowest dose. Take that lowest dose for about a week. See how you feel. If you start seeing an improvement, maybe leave it at that, maybe up it a little bit. But you really just want to up the dosages until you notice an effect, and then stick with the dosage you have and see how it goes. In general, the dosages for CoQ-10 go between 90 and 1,200 milligrams a day. You should not take more than 1,200 milligrams a day. And as standard care for muscle pains like you have in fibromyalgia, or also if you're on a statin, is usually 90 to 200 milligrams a day. If you have heart issues, a lot of the studies hone in around 300 milligrams a day. For migraines, which there are studies that show that CoQ-10 has a positive effect on that as well, the dosages are usually recommendations between 300 and 400 milligrams a day. And as usual, if you're thinking about adding a new supplement to your diet or to your regular regimen, especially if you're on medications, always make sure to run the new vitamins or the new supplements by your doctor first, so you can get feedback, and then you and your doctor as a team can work to figure out how the supplement is best introduced into your diet or into your life. Have a good day.